In this video, I'm going to cover the basics of uterine fibroids, including what are they, who gets them, what are the symptoms of fibroids, how do you diagnose them, and a little bit about the treatment. Uterine fibroids are also called leiomyomas or myomas. They're growths that appear in the uterus, and they're made out of uterine muscle. And it's actually smooth muscle, which is really unusual. It forms into balls that are connected to the wall of the uterus. They're not cancerous, and they're very, very common. Hi, I'm Dr. Brian. In fact, 75 to 80% of people with a uterus will be diagnosed with fibroids some point in their life. The fibroids usually show up early, 20s or your 30s, because you have high estrogen levels, and these make fibroids both grow in size and number. Conversely, at menopause, when the estrogen goes down, fibroids shrink. Fibroids can really vary in size, quantity, and even growth rate. And the reported sizes go from the size of a pinhead up to the size of a melon. They've been reported to weigh up to 40 pounds. Each individual is a little bit different. And you can have just one or you can have many. And oftentimes, if you do have many fibroids, some are very small and then some can be very large. We think that uterine fibroids happen because a single cell of muscle divides over and over and over. And that creates this firm, rubbery ball or mass of tissue in the uterus. Physicians aren't really sure exactly what sparks this behavior, but we know there are specific risk factors that make you more likely to get fibroids. A big one is race. For reasons that are really unclear, fibroids are much more common in African American women. And these in fact can be 2 to 3 times more common in African American females than in white females. Second, family history. If your mom or your sister had fibroids or have fibroids, you're at a much increased risk of also developing fibroids. Then there's some unusual ones. Alcohol, specifically beer, appears to be associated with a significant increased risk of developing fibroids. And then there's something I would call reverse factors. These include parity and diabetes. Parity, or having children, especially if you've had one or more pregnancies that has gone beyond 20 weeks of gestation, that actually significantly decreases your risk of having fibroids. And there's some evidence that the more kids you have, the less risk you have for fibroids. And finally, there's a number of studies that show your risk of having myomas or fibroids if you have type 2 diabetes is actually significantly lower. So what are the symptoms of fibroids? Well, most people with fibroids don't have any symptoms, and that's why they're often found unintentionally during a routine checkup. If a patient does have symptoms, heavy, prolonged, painful menstrual bleeding is a really common presentation. Periods that last more than 1 week, or heavy soaking of pads and tampons, or large blood clots are all considered common symptoms of fibroids. If fibroids get very large, they can cause your belly to bulge like a pregnancy. They can also press on nearby organs, causing pelvic pressure, frequent urination, or difficulty with bowel movements. Fibroids are often found kind of accidentally during a routine pelvic exam. And if your doctor feels an irregularity in the shape of your uterus, or if you do come in with symptoms, the first thing that will happen is they'll probably organize a diagnostic ultrasound. This is really good to look at position, size of your fibroids. And occasionally they may even go on to an MRI if there's additional questions. So if you do find fibroids, how do you treat them? There are many ways to treat uterine fibroids, but if you have no or only mild symptoms, as many or most women do, the best treatment is do nothing. So watchful waiting. If that's not the case and you have bothersome symptoms, there are certain medications. Birth control pills is one of the options. This can relieve some of the symptoms of the heavy, irregular bleeding or the painful periods. This is because it usually affects the level of estrogen. For more severe cases, surgery may be needed, and these range from very invasive to less invasive. A hysterectomy, where the uterus and the fibroids are removed together, that's the most invasive option, and it's a great option if you're not interested in pregnancy, and it has a 100% chance of eliminating the bleeding and the fibroids don't come back. A less invasive option is what's known as a myomectomy. This is a surgery where a physician will go in and remove one or more of the fibroids, but they leave the uterus intact. One of the least and one of the most fascinating ways to treat fibroids is known as uterine fibroid embolization. This is a much less invasive procedure that uses a catheter going into the blood vessel that feeds the fibroids. Then your physician will put little particles out through that catheter. Those particles float out and block the blood vessels to the fibroids. That causes them to shrink, and your uterus stays in place just as normal. There are a number of additional techniques which are not usually used that often. A radiofrequency fibroid ablation is where a special probe is inserted into the fibroid. It heats up the tissue so that the fibroid shrinks. There's also something known as magnetic resonance guided focused ultrasound. This also passes energy through the abdomen without putting anything in there and helps destroy the fibroid. Lastly, there's something known as an endometrial ablation. This is fairly common. This is very specifically done for bleeding, and it's a procedure in which a device is inserted through the vaginal opening and it treats the uterine lining. It doesn't necessarily really do anything to the fibroids, but it can be effective for stopping the bleeding that fibroids cause. That's uterine fibroids. If you're interested in other medical conditions, you can try this video where I explain diverticulitis. Thanks for watching, and don't forget to subscribe.